My name is Sarah Surgeoner. I'm Communications Manager at St Patrick's Mental Health Services here in Dublin 8.
And you're running a radio station this week, Sarah?
We are. We're running Upbeat On-Air. It's Ireland's first all-digital pop-up radio station dedicated solely for the promotion of positive mental health. So we're broadcasting every day for the 5 days from 7 a.m. to 10 p.m. every night, which is a huge undertaking. And we have some super presenters, super researchers and producers as well on board who are giving us their time for free. So they're all coming on board because they get it. Every single person that we've asked to get involved, we've asked because they are supportive of positive mental health and they're advocates for positive mental health and well-being. So,
what's the purpose of the exercise? Why do this? Why run this?
Initially, because we are, as a nation, pretty awful about talking about our mental health, about talking about our feelings in general, and I suppose for mental health the most important thing is to be heard. So listening is really important, and that's where we came up with the idea for radio as a really good medium to be heard and to talk about your mental health problems. So the combination of the two, if that makes sense. So when we proposed this idea last November, it seemed like a great kind of far off kind of a distance, but we've been working on it since then, and with the help of the lovely people in the BAI who gave us the licence, as well as the likes of the backing of RTE and other broadcasters who have very kindly given us a helping hand with lending us their presenters and staff for the week. Here we are, and you know, it's been really well received by the public, and which bodes well, I suppose, for, you know, talking about these mental health issues going forward. So we're delighted.
And it's part of a broader outreach by St Patrick's Mental Health Services, isn't it? It's not just about treating people here at the hospital. It's also about getting the message out into the community. Tell me how you go about that.
Well, I suppose the idea really is to try and keep people out of hospital, to try and, I suppose, allow people to get well at home in their own community, surrounded by their own loved ones and with their families. So we're not just based here in Dublin 8. We have clinics, we have 7 community clinics, and the idea really is to try and treat people before they need hospitalisation. So with that in mind, we are trying to change hearts and attitudes and I suppose conversations around mental health. And we hope that with this kind of an initiative that we'll be encouraging early intervention, because we know that if we can get people early, they have a much better chance of recovery.